Good afternoon, everyone. Today I'm going to talk about carpal tunnel syndrome. So it is actually a very common problem in clinical practice. I will talk about the carpal tunnel syndrome, what's the possible causes, and the clinical manifestation, and the common treatment in acupuncture, and also self-care massage point. As you can see on the photo, the carpal tunnel syndrome is usually indicated on the palmar side of the wrist. There's a strong transverse carpal ligament, and the carpal bones, including the hamate, capillate, trapezium, and trapezoid, form osteofibrous canal known as carpal tunnel. Within this tunnel has the flexor tendons of the fingers and the meridian nerve. When the pressure inside of the tunnel increases even slightly, it can compress the meridian nerve and produce corresponding clinical symptoms. And these symptoms is called carpal tunnel syndrome. I will find a video for you to have a look.
In some jobs, use your hands a lot. Assembly lines, construction, or even working as a cook. And people who work with their hands or use their hands a lot may get carpal tunnel syndrome. That's because using your hands in certain ways may put pressure on a nerve that runs through a narrow space in your wrist. This space is called the carpal tunnel. Pressure on this nerve can cause pain, tingling, weakness, and other problems in your hand. So what type of actions do you need to be careful about? Actions where you bend or twist your wrist, like using a screwdriver. Repeated movements are also a problem. Chopping, hammering, knitting. Well, you get the picture. And using tools that vibrate, such as sanders or drills, can also lead to carpal tunnel. So because using your hands in these ways can help cause carpal tunnel syndrome, making a few changes may help prevent it. These changes may also help improve your symptoms or keep them from getting worse. We like to think of these changes as the 4 S's. The first S is straight wrists. Keep them straight and twist them as little as possible. For example, when I type like this with my wrists bent, that's not a good thing. This is how I want to type. Keep the wrist straight with the hands a little higher than the wrists. The same goes when using a mouse. Keep your wrist straight and try not to bend it. And when you type or knit, Keep your forearms parallel to the floor. The second S is stop and take a break. Stretch your hands and wrists, get up and move around. And the third S, slow down. Reduce how fast or how strongly you do an action. And the last S, switch hands or positions if you can. And try not to grip things with just your thumb and index finger. Use your whole hand if possible. And if you're using power tools, try wearing gloves that are designed to help support your wrists and have padding to help absorb vibration. And remember, stop doing anything you think is causing numbness or pain. Take a break and try again. Start slowly and maybe use your other hand. If things don't get better, see your doctor. The 4 S's may help you prevent carpal tunnel syndrome and help with any symptoms. Would any of these work for you? Pick one and see if it helps.
So as you can see from the video, there are many possible causes of increased pressure with the carpal tunnel, including trauma, such as wrist fractures, distal radial fracture, and dislocations. Second possibility will be overuse or strain. For example, excessive wrist flexion or extension, leading to thickening of the transverse carpal ligament. And the third one will be endocrine changes, for example, such as pregnant, menopause, or like diabetes. Hypothyroidism, like all of these. The third one, the fourth one could be anatomical variations. What does that mean? It means low positioned flexor muscle bellies or high positioned lumbrical muscle entering the carpal tunnel and increasing its contents. The fifth one is space occupying lesions such as ganglion size or lipomas or other tumors with tunnel. And then the sixth one will be inflammatory conditions such as pneumatism or pneumatoid arthritis causing the carpal tunnel symptoms. So in the clinical manifestations, the main symptoms including numbness, tingling, or burning pain in the radial 3.5 fingers of the affected hand. The pain may radiate to the hand, elbow, or shoulder. It often occurs at night or it's in the early morning. The patient may experience the thumb weakness and pins of needles, and but there are a few tests that you can confirm if it's a carpal tunnel or not. The first one is called the Tinel's sign. So like you're tipping over the wrist, and it might be produce a radiation pain to the median nerve distribution. And then when the patient holds both wrists in the flexion for about a minute, so it might be also generate numbness. And also the x-rays on the wrist can help to exclude other bone or joint disorders. And so in Chinese medicine, the treatment it's to promote the circulation of the tendon and the channels. The common use the acupuncture is pericardium 6 and pericardium 7 and lung 10, as well as the palmar side of the forearm, wrist, and the hand. The common technique will be like rolling, pressing, finger kneading, joint mobilization, grasping, and rubbing techniques. So for the self care, so you can do at home is that you can massage the leg one, 大陵, like the pericardium 6, pericardium 7, lung 10, and large intestine 4, for about 5 to 10 minutes. So here's also other type of treatment. If you are interested, also have a look.
Hello, we're going to talk about the carpal tunnel and then also talk about something called carpal tunnel syndrome. Now, the carpal tunnel is a narrow passageway found on the anterior portion of the wrist. It serves as the entrance to the palm for several tendons and the median nerve. Carpal tunnel syndrome is a condition that occurs when the median nerve is compressed within the carpal tunnel. This is a common condition that causes pain, numbness, and tingling sensation in the fingers, especially at night. Let's talk a bit further about the anatomy of the carpal tunnel. The carpal tunnel is a narrow passageway that allows tendons and the median nerve to pass from the forearm to the palm. This passage is bordered by a combination of bone and ligament structures that create its unique shape and function. Talking about the borders, the tunnel's floor and sides are formed by the carpal bones arranged in a concave shape, known as the deep carpal arch. The roof is made by the flexor retinaculum, a thick connective tissue band forming the arch into a closed tunnel. The carpal arch. This structure is defined by specific bones. Laterally by the scaphoid and trapezium tubercles, and medially by the hook of the hamate and the pisiform. The flexor retinaculum serves as the tunnel's roof, and it spans between the hook of the hamate and the pisiform medially to the scaphoid and trapezium laterally, effectively converting the carpal arch into the carpal tunnel. To locate the carpal tunnel on yourself, the distal wrist crease serves as an excellent landmark, aligning with the tunnel's entrance. Now, the components of the carpal tunnel. The carpal tunnel houses 9 tendons enveloped in synovial sheaths, facilitating their smooth movement alongside the crucial median nerve. The tendons here include the flexor pollicis longus tendon, 4 tendons of the flexor digitorum profundus, and 4 tendons of the flexor digitorum superficialis. All these tendons are essentially your flexors. They help make a fist. Notably, the flexor carpi radialis tendon, often mistaken to be within the tunnel, actually lies outside, beneath the flexor retinaculum. And of course, there's a median nerve. Upon traversing the tunnel, it branches into the recurrent branch and palmar-digital nerves, crucial for sensory and motor innervation of the hand. And this leads us to carpal tunnel syndrome. Carpal tunnel syndrome manifests from the compression of the median nerve within the carpal tunnel, leading to pain, numbness, and paresthesia, primarily in the lateral 3.5 digits. It represents 90% of all nerve compression syndromes, so very common. Carpal tunnel syndrome shows a high prevalence in women, particularly between the ages of 45 to 60, so really menopausal. Risk factors include gender, as we mentioned, women, age, obesity, wrist injuries, and certain systemic conditions such as diabetes and rheumatoid arthritis. The typical clinical presentation, so the typical signs and symptoms. Well, people typically report worsening symptoms at night. Symptoms are worse at night because when individuals are not active during the night, there is an increase in fluid around the hands, an increase in carpal tunnel pressure. They often wake up and have to shake their hand to get relief. On examination of carpal tunnel syndrome, sensory deficits usually occur late in the course of carpal tunnel syndrome, and they involve, as mentioned, the first 3.5 fingers, but spares the thenar eminence. Weakness, however, occurs in thumb abduction and thumb opposition, which can also lead to ape-looking hands. Atrophy of the thenar eminence may be present because many muscles here are innervated by the median nerve. There are also provocative maneuvers which are pivotal for clinical diagnosis of carpal tunnel syndrome. Provocative maneuvers essentially try to aggravate or stimulate the symptoms of carpal tunnel, and these include Tinel sign, where someone taps on the volar aspect of the wrist over the median nerve, and this will produce symptoms in the distribution of the median nerve typically. Then there is the Fallon sign, where the wrists are flexed essentially 90 degrees for 60 seconds and may reproduce symptoms in the distribution of the median nerve. Then there's a closed fist sign, where flexion of the fingers into a closed fist for 60 seconds may produce the paresthesia in the median nerve distribution. And finally, there's a compression test, where pressure is done by the examiner with their thumb on the palmar aspect of the patient's wrist for 30 seconds, which may produce the paresthesia in the median nerve distribution. Investigations and management. While the diagnosis of carpal tunnel syndrome is primarily clinical, using all the history, the signs, and clinical examination, nerve conduction studies can aid in confirming median nerve damage in uncertain cases. First-line therapy is conservative management. And this includes wrist splinting and hand therapy, with a corticosteroid injection and anti-inflammatory drugs being optional in certain situations. Then there's surgical treatment, and this is reserved for cases that are unresponsive to conservative measures. Carpal tunnel release surgery involves severing the flexor retinaculum to alleviate median nerve compression. So in summary, The carpal tunnel is a narrow passageway that allows tendons and the median nerve to pass from the forearm to the palm. However, the median nerve can be compressed due to a variety of risk factors and conditions that can lead to something called carpal tunnel syndrome, which really manifests as numbness, pain, altered sensation in the lateral 3.5 digits or fingers, the thumb, the index finger, and the middle finger and the half. Treatment includes conservative and surgical management. Thank you for watching.
So this is all about today's topic, carpal tunnel syndrome. I hope it's helpful for you and see you next time.